Collagen Induction Therapy Microneedling Part 2, presented by Herbal Skin Solutions. In this series, we will be discussing client selection, how to know if microneedling is right for your clients based on client skin concerns, and how the treatment works from the inside out. So let's dive right into finding out who our ideal candidates for treatment are. An ideal client has a healthy lifestyle. They are currently on professional home care routines. You are familiar with the client's skincare concerns and what they want to improve so that you can manage realistic expectations for treatment. They either are coming in for regular office visits currently or they're open to it. And they follow proper post-care instructions or have agreed to. After all, making sure that you have the ideal client will help you to create more clients through referrals as they are your walking billboards. Microneedling has many advantages. Estheticians and tattoo artists in many states can perform this treatment. Microneedling is much more affordable than laser resurfacing. It keeps the skin intact instead of ablating the skin like in laser, and it's safe for all skin types. Microneedling is the mechanical breakdown of scars leading to remodeling. It thickens the epidermis, which gives us thicker, bouncier skin with more volume, things that decrease over time. So it's a really great treatment to give that back to our skin. It improves cell-to-cell communication, leads to regenerative healing, and can be used on most areas of the body. The rapid healing and minimal downtime make this an ideal treatment. Now that we've gone over the benefits, let's dive into the needling contraindications. Now, microneedling has no known negative side effects. All negative side effects come from improper patient selection or clients not following post-care. So needling contraindications will begin with irritated skin or any sort of immunosuppression disease. So anyone with bloodborne pathogen disease such as hepatitis, HIV, AIDS, lupus, any sort of immunosuppressive disease to where your cells do not repair at a rapid rate. When your cells are unable to repair at a normal rapid rate following microneedling, it could lead to delayed wound healing, which can also lead into a secondary infection. We do not work over active acne because it can spread. So avoiding cross-contamination is important. Active pustular or nodular rosacea is an absolute contraindication. Anticoagulant medications such as warfarin or Coumadin, those are blood thinners, so we avoid those. But there are other blood thinners that are natural supplements. For example, St. John's wort, garlic, ginkgo, vitamin E. And blood thinners can lead to bruising, so that's why we choose to avoid those. Unhealthy lifestyle. We definitely need the client to live a healthy lifestyle so that they see the best results and they heal quickly. We do not work over eczema or psoriasis because needling can exacerbate dryness in the skin. We never work over skin cancer, raised moles, warts, opened wounds, or sores to prevent infection or further damage. Skincare concerns microneedling can improve are wrinkles, pigmentation, mild rosacea, scarring, acne, thermal and surgical scars, loose, lax skin, UV, sun damage, stretch marks, and cellulite. Now that we know the benefits, let's discuss the side effects of needling. And again, microneedling has no known side effects. These side effects all come from not properly performing patient selection So taking a client that is not an ideal healthy client, or the client not following proper post-care. So the side effects that are most typical are feeling of having a sunburn. So freshly treated microneedling skin is going to feel a little red and like a little burning and stinging sensation similar to a sunburn. If a manual exfoliation is not performed prior to needling, there may be some dryness and flaking, which will not last more than a couple days. And if the skin is properly hydrated post treatment, these side effects are unlikely. Track marks, however, unlikely can occur if improper technique is administered. So, by re entering in the same microchannels over and over again, you are enlarging the channels, making them more noticeable to appear as track marks. So, it's very important that we apply proper method when administering the treatment. Breakouts are a possible side effect. To avoid breakouts during treatment, we consult our clients recommending a healthy, nutrient-dense diet. Dark leafy greens are most beneficial, and it is important to avoid high sugar foods. To further prevent breakouts, the professional can administer high frequency or oxygen infusion on the area to be treated prior to microneedling, and LED therapy can be administered following treatment to further prevent bacteria. Swelling and a rash can occur. That is due to the histamine reaction. If your client is prone to allergies, that means that they may have a higher level of histamine in their bodies, making them more likely for the swelling histamine reaction. An antihistamine can be taken following treatment to reduce these side effects. Bruising, however rare, can occur if too much pressure is administered during the treatment. When using an electronic device such as the CIT pen, it's important for the technician to hold the microneedling device as if they were holding a pen writing on paper and applying comparable pressure to if you were using a pen to write on paper. Just letting the device glide with ease as you guide it in the proper method. Again, bruising can also occur if you are on blood thinners, medications, and supplements. Cold sores, unlikely, however, they can occur if you are prone to them. If you have ever had a cold sore ever in your life, that means you are prone. The technician can either avoid the treated area, or you can ask your medical practitioner for an antiviral such as Valtrex. That prescription will help avoid cold sores, and there are also natural alternatives such as lysine. Post-inflammatory hyperpigmentation, PIH, is another rare but possible side effect. The side effect is often seen when the internal core temperature is heated or the treated skin is exposed to the sun immediately post-treatment. So again, following post-treatment outlines are very, very important to avoid side effects. Let's take a look at how microneedling helps lax skin. You'll see the before and after is the after is just one treatment using the 12-tipped needle cartridge. We are able to help wrinkles in the skin by triggering the wound cascade. And you can refer back to the microneedling series part 1 webinar to learn more about the wound healing cascade. Incredible results. On this next slide, you'll see how microneedling has helped the UV damage in this client through her cheeks, upper lip, and nose. Microneedling increases the availability of cell nutrients and antioxidants, which helps to lighten sun damage and normalize cell-to-cell communication, which also helps to lighten and brighten the skin. Here you can see how microneedling has helped hyperpigmentation. The before picture above, you can see all of the hyperpigmentation through her cheeks and jawline. And the after photos, after 3 treatments with the 12-tipped cartridge, you'll also see how the wrinkles around the eyes and in through the cheeks have been smoothed and the texture has been retexturized. Microneedling restores keratinocyte function, normalizing melanocytes. It restores the collagen-producing cell fibroblast function, and it normalizes the melanocyte differentiation. Here you'll see another before and after for acne scarring. We know acne scarring is caused by elevated histamine levels, exaggerated response to tension of keloid fibroblast, recurrent trauma, infection, and excess wound tension. And microneedling helps that by breaking down the existing scarring, allowing natural wound healing cascade without the scar cascade, and increased MMP model for scar tissue. Here, you'll see how microneedling can be used on the body. Microneedling helps stretch marks. Microneedling can improve the density of the epidermis via stimulation of epidermal growth factors. The epidermis in stretch marks is atrophied and support structure is compromised. The results are sometimes unpredictable and the patient should be counseled properly. It's always best to underpromise and overdeliver with these types of treatments. The healthier the client is, the better the results will be. Now, how often can these treatments be performed, you may ask? Cosmetic needling, the face, neck, décolleté, the tops of hands, can be formed as frequently as every 3 weeks. And again, cosmetic needling is working up to 0.3 millimeters deep. Medical microneedling, 0.5 and up, needs to be spaced out with a 4 to 6 week minimum of treatment frequency. And again, this is for body treatments, cellulite stretch marks, old acne scarring, and C-section scars.